Hi, my name is Jackie Clendenin, and today we're going to talk about dissociative identity disorder, formerly called multiple personality disorder, and dissociative amnesia. DID and dissociative amnesia are both in the DSM-5-TR, and for DID, the following criteria are required. There has to be a presence of two or more distinct identity states or personality parts. That's where the name multiple personality disorder came from. There have to be gaps in the memory for daily events, personal information, or trauma, significant changes in behavior, feelings of detachment, which is considered depersonalization or derealization, difficulties maintaining consistent and personal, social types of relationships, and we want to make sure that these things are not being caused by substance abuse or medical conditions such as epilepsy or the like. When we come to dissociative amnesia, the inability to recall important personal details related to trauma, as I stated before, is probably one of the biggest characterizations that we will use for this psychological disorder. This memory loss can involve specific events, entire periods of time, or sometimes you can have a complete loss of identity. This is a defense mechanism against overwhelming emotional pain, and this can definitely disrupt daily functioning. You will see important qualifications for this, and one of those is a disrupted retrieval of memories associated with dissociative fragmentation in identity, memory, and consciousness. So again, dissociative fragmentation in identity, memory, and consciousness. There should be, you're going to see like no underlying, again, neurological or medical cause for the memory disruption. The patient will unfortunately suffer confusion, distress, or disorientation when their memory gaps are noticed. So one of the reasons that I chose these topics, I should say the reason I chose these topics, I noticed that they are highly misunderstood and they are often underdiagnosed and undertreated. I think there is a significant gap in awareness, accurate information, and effective therapeutic approaches. I would really like for more people to understand their complexity, advocate for improved education and support in the mental health system as well as in the legal system, and just in general for individuals who do experience dissociation as a coping mechanism for trauma. Most of these studies are done with someone who is incarcerated, so either someone who is in prison or is in a mental health facility. And I specifically studied one, or I should say I researched one study that was done on 231 consecutive admissions to an inner city mental health hospital. They were able to interview 82 people who were willing to cooperate, and those patients were not selected on a pre-screening measure for dissociative symptoms, and that clinic itself had really no reputation for interest in the disorders. They found that 24 of the 82, so that's 29% of the subjects, met the criteria for a dissociative disorder. So the amnesia, DID, or depersonalization disorder. That is a surprisingly high figure. And that is something that does suggest that this is an undertreated and underdiagnosed disorder. So only 5% of this group had been previously and correctly diagnosed. So oftentimes people with DID will present in the criminal justice system and in the mental health system, as I stated, and they will perplex experts in both professions. So what you do see is someone who may be facing a conviction for a very serious crime, rape, murder, burglary, I mean, name it. Those people may have no recollection of what took place. They might not be able to piece together the events, therefore not being able to make a thorough legal defense for themselves. And so this is another reason that it's important that people be educated in dissociation as a defense mechanism. Another reason that this is interesting is because what can happen is people will try to use a multiple personality disorder claim to have a, not guilty by reason of insanity plea, when they may not even be suffering with the disorder. Lastly, when we talk about the impacts of the disorder, this isn't necessarily an impact of the disorder, but it gives you a sense of the impact to the individual. Spiegel noted that both physical and sexual abuse have been added to the list of symptoms for dissociative disorders. So the odds ratios of 5.86 for physical abuse and 7.87 for sexual abuse. So that tells you what these individuals have been subjected to. So moving right along, we're going to talk about current research findings. Scientists have shown that we can distinguish this disorder from other psychiatric disorders. We also know that this can be self-reported or it can be observed externally by other individuals. Couple of other things real quick, as I stated, changing the name from multiple personality disorder to associative identity disorder definitely helps people, clinicians, to understand what the disorder really is and accurately diagnose it. Also, when you see a history of a traumatic event or a PTSD diagnosis in an individual, that person is 14.4% more likely to also suffer with a dissociative identity disorder. Treatment and interventions, there really aren't very many, unfortunately. Right now, there are no medications known that will help dissociative identity disorder. However, psychotherapy is a very effective and long-acting treatment. Some people have talked about in the future using psilocybins and other psychedelics. However, we don't think anybody, that's not verified and it's not approved at this time. I'm going to pause here and give you a moment to read this case study. This case represents dissociative amnesia for a few reasons. First of all, Emily lost access to specific memories tied to a traumatic or overwhelming event. Her memory gap involved personal details during a stressful situation, especially about the night before the incident. The memory came back later, suddenly, and unexpectedly during a flashback, and there is no evidence of physical brain injury or illness. Her memory loss is linked to emotional trauma. This case shows how the mind can block out painful experiences as a way to protect itself, which is a key feature for dissociative amnesia. In conclusion, this disorder, formerly multiple personality disorder, was thankfully changed to the dissociative personality disorder or dissociative identity disorder name, which allows clinicians to assess it in a swifter and more precise fashion. These disorders are notably prevalent within our communities when trauma is involved. The disorder interventions are limited, while research is also limited. And thankfully, we have discovered that a patient-centered approach with a professional psychotherapist is the safest and best way to control symptoms and provide relief. I hope you've learned something today. Remember, take it easy on yourself and each other.